Hi, everyone. Welcome to our presentation on alcoholism, its risks, and potential interventions. So right now we're going to talk about the background. That's what is alcoholism. Here are some stats on alcoholism. What's most important is that alcohol abuse is the most common and costly form of drug abuse, and it is a major contributing factor to many disease categories, such as diabetes, hypertension, cardiovascular disease, stroke, and pneumonia. The epidemiology of alcoholism. These data is gathered from the National Epidemiologic Survey on Alcohol and Related Conditions. This was a large survey that was done face-to-face with a representative US adult sample of around 43,000 people. Most importantly, 17.8% prevalence of lifetime alcohol abuse and a 12.5% prevalence of lifetime alcohol dependence was reported. Some of the underlying causes of alcoholism are biological factors, specifically genetics. Alcoholism has been linked to up to 51 genes on different chromosomes, and different family members are significantly more likely to have drinking issues if these genes are passed down through generations. Environmental issues. People who work in or live near alcohol establishments are said to have a more positive attitude toward drinking. Social factors such as culture, religion, family, and work can all impact your views on drinking. And psychological factors, people who have severe stress, anxiety, depression, other mental health issues are more likely to develop alcoholism. Frequently it's used to suppress feelings, ease the symptoms of those psychological disorders. So here's some risk factors of alcoholism: drinking over time, frequent alcohol consumption over a long period of time, family history, again, going back to genetics, starting age. If you start binge drinking early, you're more likely to develop alcohol use disorder, and a history of trauma, which can also be related to those mental health disorders. Typical management strategies for alcohol use disorder are behavioral therapies, such as cognitive behavioral therapy or CBT, motivational enhancement therapy, which helps develop and strengthen motivation to change, marital and family counseling, which can aid in the rehabilitation and enhancement of family connections, and brief interviews, typically in a group setting. Medications like disulfiram, naltrexone, acamprosate, all create different feelings that can aid in the reduction of alcohol use. So here we're going to go into our clinical scenario and meet our patient, Emily. She's 21 years old. She is a cisgender female. She lives in Apache Junction, Arizona. She attends ASU. She's a junior and a commuter student, so she drives in every day. And she is a bartender. Emily is currently enrolled with a 3.7 GPA, and she takes 18 credit hours per semester. So she's at a very heavy course load. She drives to and from school and work every day. So she goes in early, comes back late, and she spends time with her friends at the bar where she works after her shift. Her comorbidities include a diagnosis of depression, and she's also been in inpatient substance use disorder treatment for opioids in 2018. Some of her family medical history. Her mother is 45, divorced for 10 years, healthy, no history of cancer or heart disease. Her grandfather had a history of depression, again, going back to genetics. Also, the divorce 10 years ago, that could have been traumatic for Emily. She was 11 years old. Her father is 43 years old, divorced for 10 years, high blood pressure. His father died of lung cancer at 51, and his grandfather had a history of alcohol abuse and problem gambling, again, with the genetics. So let's talk about interventions. The first plan is motivational interviewing. And before we talk about motivational interviewing, it's important to get a brief overview of what it should look like and what benefits it presents to patients who are ready or interested in change. So as providers, we need to ensure that we're listening to our patients, asking the right questions, and building that successful relationship between the provider and the patient. Patients who are introduced to motivational interviewing are far more likely to enter, stay, and complete a course of treatment. We can also look at motivational interviewing with the lens of social cognitive theory, which looks at how personal factors as well as environmental influences affect individuals. Here we know that Emily's environmental influences are work. She's a bartender, she's surrounded by alcohol. Her personal factors are how she's already been to treatment once. So we can combine social cognitive theory with motivational interviewing and hopefully have some success working with Emily. Here are some do's and don'ts of motivational interviewing. The point is that we're going to talk to her in a way that meets her where she is and where she's listening and where we're listening to what she has to say. We also know that she struggled with substance use disorder in the past, so working with her to find ways she feels motivated to enforce positive health behaviors is key. And as the provider, we want to ask Emily questions that will guide her to work through her own feelings and reinforce self-efficacy. Keeping things positive will help in this. When you went through rehab and your previous struggle with opioids, what were some of the moments that made you feel empowered or in control? Identifying those feelings of empowerment and control and finding out ways that she can apply those to her life now could affect positive change for her. Our next intervention is nudging. Nudging is a concept where you nudge and slightly push your patient toward changing physical or social environmental, making these changes to influence healthier behaviors. So in this case, we would probably focus on environmental nudging, which would mean changing who you spend your time with, your surroundings at work. These questions can go hand in hand with the health belief model. Do you find that drinking results in negative feelings or events? She says yes. Would you like to change? She's probably going to say yes. And then you find out where she could make changes. The suggestion would be to maybe find a new job, one where she's not surrounded by alcohol, and maybe something that she's passionate about that she would enjoy doing as well. Our final intervention is Boggs' behavioral model. This shows that the three elements must converge at the same moment to create a behavior. Those three elements are motivation, ability, and a prompt. And in Emily's case, we're going to find out what the root cause of her drinking is and try to develop new patterns to replace that negative behavior. As her provider, we would begin to ask questions, the root cause of that caused her this behavior, and then try to find new coping mechanisms in order to create new behaviors. Emily, how was your childhood? Emily, what are your motivation for your goals in life? We want to find out what motivates her and constitutes ability and what can prompt her to make those changes. So that is it, everyone. Thank you for joining us and have a great day.